Okay, we're here at the second iteration of the AEDE, Agricultural, Environmental, and Development Economics podcast series. We're here with Zoe Plakias, who is an assistant professor in the Department of Agricultural, Environmental, and Development Economics at Ohio State University. She's an expert in the food supply system and is here to talk with us today about the food supply system and some of the interesting things that have happened with the food supply system in the last few months. So Zoe, I guess the first question, and I think it's the question lots of people have been wondering is, what is happening with our food supply? Many of us, if we go shopping and wander into stores, we see shelves that aren't quite as full as they used to be. And we see, especially in the meat supply, we see that sometimes we can't get as much meat as we'd like, or maybe we can't get it at all on any particular trip to a store. So what's going on out there? Can you sort of give us some insights on that?
Absolutely. First, thank you. I'm glad that we can have this conversation and talk about this. And what's happening right now is that this is a really unique situation because unlike some shocks that we see in our food supply chain where there's a shock at a single kind of point in the supply chain that ripples out, we're seeing that every point of the supply chain is affected because every point of the supply chain has people, and people are the kind of vulnerability here with our pandemic. So that means that the challenges that are coming from this pandemic are really complex, I would say, and they're changing very rapidly over time. A couple of the big things that we're seeing that are causing some of the situations that you talked about are these. First of all, we're seeing a shift in where people are buying food. In normal, quote unquote, normal times, we see more people eating out at restaurants. We see more people eating at institutions, at schools, at colleges. And so we have seen those supply chains that go to those places. Now the suppliers are having to shift their supply to sell to the places where we are buying food, right? We're buying a lot of our food at grocery stores, for example. And so one of the earliest things we saw in the pandemic was that shift was occurring, and it didn't occur overnight. And so there were some shortages that folks were seeing, some empty shelves that folks were seeing for the most popular items in the store. In addition to that, what we are seeing in the processing sector, which is, of course, has gotten a lot of media attention, is that there's in processing plants, especially for meat is where we're seeing it now. People are working in close proximity on these kind of assembly line type things where they're cutting and processing meat. And so these places are places where there's a lot of vulnerability. And we're seeing some outbreaks in these meat processing plants. We're also seeing some fear, I think, which is understandable by workers to come to work. And we're seeing other challenges that are the same challenges that are faced by other people, which are, when schools closed, folks needed childcare. Workers in our food system are, they have the same challenges that you and I have in the pandemic and more because they're working in this close proximity, whereas you or I can just work on our computers, right? So I think that is one of the things that we're seeing, and so that has caused some shutdowns of plants at various times. It's also, consumers might not recognize this, but it's also affected our producers who would be normally supplying meat to those supply chains. Their livestock are having to figure out what to do with those animals. And that's very frustrating for us to see. Well, there's all of these animals and there's all these people without a lot of money or who maybe are not able to get the food they need right now. How do we make that connection? So we are seeing that bottleneck, and that is contributing to some shortages that we're seeing in the grocery store.
That's super interesting. So we've got two things that I really heard you say. One is just the shift in where people are eating. So they used to eat out more. So you're saying all this food used to go in one direction, and then it had to sort of switch directions, right? And it just takes a while for that shift to switch. Is that what you're saying?
Yeah, I am. There are some observed price increases for groceries as well right now, and that's actually a result of that shift, right? If we think through the economics of that, you have an increased demand for food at grocery stores. In some cases, you have a decreased supply we would expect, and then kind of just the simplest supply and demand framework that would raise prices for those items, right? So that is also something that folks are seeing and I think are concerned about, and understandably.
Yeah, so this food is sort of moving a different direction. Price has gone up, and maybe that helps mitigate some of the sort of big demand increases because, people who see a higher price maybe decide to buy a little less. That's interesting. But the second issue you said was this processing question, and that there have been, been some outbreaks in some of these places where processing occurs, and some of the plants themselves, and people who work in those plants are just like you and I. They don't want to be exposed, so maybe some of them are taking days off that they wouldn't otherwise, right?
I think that's the case. I mean, plants are operating differently and trying to address these issues. Some plants we've heard are just kind of changing. At a certain point, if it's a big enough issue, there could be some kind of more drastic measures like shutting down. I want to say too that we're seeing this in meat processing. I think this is possible in any kind of processing sector, and we're trying to be cognizant of what this could mean for say vegetable processing or other types of processing as we move through the harvest season, right? We have to recognize we're in June right now, but and these were issues that were coming up in, say, April and continue, but other processing occurs at other times of the year.
So we may actually see some of these same issues with meat arise in other products down the road.
I believe we could, and I don't want to scare people with that at all, but I think one of the things we're trying to do is to be really prudent and think about what are the possible things that we could see here. What are the conditions that are causing this? There have been some outbreaks, say in New York. There was an outbreak at a greenhouse. Again, it's these conditions. It doesn't have to do with meat specifically. It has to do with the conditions that occur in a meat processing plant.
Fascinating. So, if we were able to sort of do that magic wand and wave it out there and just get rid of the coronavirus, how long would it take to get back to normal? And then, obviously we're not quite there. We can't wave the magic wand yet. So, is this just a new normal we've got to get used to, that maybe we have to be thinking of, heaven forbid, different ways to eat because the food supply has changed, really the food distribution system has changed, or is this going to get back to normal at some point down the road?
I think that the new normal right now is one of change because things are happening so rapidly, right? States are reopening at various speeds. Restaurants are reopening, for example, in Columbus. I see people eating out. And so, now that means that restaurants that maybe were only doing takeout before are probably increasing their demand back towards previous levels. As those policies change, we will see some readjustment. But epidemiologists are warning us to be prepared for possible additional waves of the pandemic, and if that's the case, we could potentially see some of these kind of bottleneck issues in the future. And so we need to be prepared for that. So I think everybody in the food system is really trying to be prepared for additional changes, and is recognizing that if we do get back to normal, it won't be probably for a while.
Yeah, and then there's the talk that if it comes back again in a worse way, it could come back in really in the wintertime next year. And so maybe we could see some of the same things next year. So does this food system, it seems amazing now that we've thought about it, how sort of intricate this food system is. I assume it's adapting. So maybe if we do go through the same thing next year, would you expect to see the impact sort of as bad, or would they maybe figure out ways around that next year, do you think?
I think that the adaptation we are seeing is amazing, and quick, given the, doesn't feel like quick enough, but quick given the large complexity of the system and how many players are involved. So I absolutely do think that people are preparing, and yet the same shocks that we're always worried about are still an issue. We're continuing to monitor the weather and consider, what could that mean for our crops this year? There are all of the other kind of normal possible shocks that happen. So I think that, we'll maybe be better prepared for this shock, and knowing what the vulnerabilities are here. We also need to be really cognizant of the other possible shocks. But it's only that I think that the more prepared we are, the more quickly that we can adapt in the future.
We thought a lot about the adaptation that people in the industry might take, but what about consumers? So there's sort of any adaptations that consumers should be thinking about taking between now and, next winter, this does come back. What kinds of things should we be thinking about on the individual level?
Well, on the individual level, I would say a couple of things. First of all, I didn't actually mention direct markets before, but we are seeing a real increase in direct markets. This is like farmers markets, CSAs, things like that, because, when there's this direct relationship that, of course, is something that people really, really appreciate, that kind of trust. It's something that people can do outside. It's something that people can do right now if they aren't as busy with work, and if grocery stores are a place where there are lots of people congregating indoors, or there are shortages of produce. These direct markets can be a good avenue for purchasing. Now, the concern right now that we're seeing is that actually, even though market vendors are taking precautions, wearing masks, things like that, some consumers aren't actually following the procedures that vendors and markets are laying out. So as a consumer, one of the things that you can do is just respect those procedures, because that will actually help ensure that those markets can stay open, right? A big concern of those farmers and those markets is that if consumers aren't following proper kind of social distancing or things right now that they ask them to do, that there could be an outbreak and they could be shut down, which would be bad for both the consumers and the farmers. So that's one thing I would say for consumers. Another thing is that one of the factors in in these stockouts, so when grocery stores are out of a certain product, that we're seeing, I think, is an element of self-fulfilling shortage, which is that if people are concerned that there might not be enough toilet paper or there might not be enough meat, then they're like, oh, well, I've got to go stock up, right? And so if everybody thinks that way, then everybody stocks up. And if regardless of whether or not there was a shortage before at the grocery store, a stock out, right, then one is created just by that fear. Okay, so I think that there's a need to recognize that and say, even if Kroger doesn't put a limit that I have to only buy 3 packs of chicken or 3, packs of pork chops, do I really need 7 of them right now? Or can I buy 3 and come back and know that there will still be this supply here? So I think that's something for consumers to consider as well.
That's interesting. I mean, I've heard that reference with respect to hand sanitizer. So if you go out and you buy 14 bottles of hand sanitizer, and your neighbor doesn't get it, or your friend down the road, or someone else doesn't get it because you bought all those bottles, I mean, you have them all stored in your house somewhere. But if they get COVID because they didn't have access to them, then actually you get COVID from that, that's just as bad. So, there's an issue here, right? A public good issue with respect to, over purchasing or, leading to some of these issues we've seen in toilet paper, meat, hand sanitizer, et cetera. Mm-hmm. And, it leads me to the question that I worry about. I know a lot of people do, is that, that these food shortages, for those of us who are reasonably well off, and I mean, we can wait a little while. We have a little food stored in the freezer or something like that. But there's a lot of people who don't have that. I mean, there's a lot of people who don't have access to storage of their own food, or they can't buy a lot of food all at once. And so if they happen to go to the store when they have the money and it's not there, then they're without. Is there a concern here with respect to people who aren't so well off and the food supply system that we're not thinking about?
Absolutely. I mean, I think we are thinking about it, but we need to put more effort into it as long as people are hungry and not getting enough food. So 2 kind of things I want to mention here. I mean, I think there's an important thing to think about here in terms of consumers and also workers in this system. People are exposed at work to COVID, and that puts their health and their families and their income and our food supply chain further, right, at risk. And so some of our low income, there's this interesting interaction here that's happening with low income folks, because low income folks are actually also the people who, many of whom are on the front lines right now in service positions in grocery stores, restaurants. And so there's kind of this double burden here of maybe a higher risk of getting COVID, and also having this challenge of a low income. And I also want to, I'm getting to answer your question, but I also want to recognize that, African American and Latino people participate in the service occupations at higher rates than white Americans do as well. So we have a lot of interactions that are happening with the type of work and race and ethnicity also as well. Getting further, though, to thinking about what all this means for our food supply chain, a couple of different ways that we usually think about helping to provide food for folks with lower incomes. One is food banks. And right now they are having a difficult time getting enough food out to everyone that needs it. And they're seeing really long wait times, right? We just have a lot of people whose income has been, negatively affected right now. The USDA did implement a food box program. They called for bids. Companies submitted bids to the USDA to provide food boxes with a specific combination of goods. A couple of challenges with this, it's actually kind of like inventing a new supply chain in the midst of this. So there are some challenges with storage. There's just not enough places to store some of these boxes, which need to go into cold storage. And some companies who bid and had successful bids are not actually really well experienced in what they're doing. This is creating some challenges for food banks who have had their normal. So then normally a lot of the way that food banks get food is like grocery stores like Kroger will donate food. So grocery stores are seeing increased demand. Food banks are having a challenging time getting food. These food boxes can provide some challenges. So those are all things that are challenging in our emergency food system right now, which is what we usually call the system that provides people with food through food banks in these kind of. Other thing I want to mention is just the Supplemental Nutritional Assistance Program, which is SNAP. What I just mentioned were in-kind donations, so giving people food directly, right? Something like the SNAP program, what that does is that's an income transfer, right? People get what essentially looks like a credit card, an EBT card, and then they go to the grocery store and they can use that. So that uses a supply chain that already exists to allow people to pay for food. Right now, some of the challenges we're having around SNAP is it's a very politically contentious program. So there's some disagreement about whether or not it should be supported, expanded, et cetera, at the federal level. And it's also, there are a lot of people who might newly need that program. It's actually quite difficult to get signed up. So if in Franklin County, for example, it can take 30 days to get signed up. You need to submit a bunch of proof of income and all these things to justify that you need it. And then you have to do an interview with somebody. So it can take a long time, even if you need it, to just get into that program. So those are some of the challenges for low income folks that we're seeing right now. But once the SNAP program, if people are signed up for the SNAP program, they can use the grocery store.
Yeah, it's super interesting and good to hear about some of the things that people can do on that angle. As I think about it, we're in this College of Food, Ag, and Environmental Sciences, and food and ag are a big part of our college. I mean, is our college doing anything to think through these issues, help the industry, help individuals think through and work through some of these sort of big problems, I guess, that society is facing?
Absolutely. I mean, as you know, we have a wealth of expertise in this area. And so Dean Kathy Ann Kress in April convened a task force. It's the Lean on Your Land Grant COVID-19 Food System Task Force. And I serve as co-chair of that task force along with my colleague, Dr. Shoshana Inwood, who is a faculty member in the School of Environment and Natural Resources and a rural sociologist. And she and I are leading this effort, the help of many, many others in our college, to coordinate our college's response to food system issues related to the pandemic. And within our college, we have many departments with researchers that focus on issues related to agricultural production and processing, food system, food consumption. And we also have, of course, our Ohio State Extension, which is a presence we have in all 88 counties of Ohio, where we have folks who are on the ground there who are connected to local stakeholders. And so we're trying to leverage the relationships that we have to both understand what the issues are and going from the ground up, asking people on the ground, and also to get people talking that maybe haven't necessarily talked before. We have in our universities become very specialized in various topics, and this allows us to go in, deep on certain topics. But the challenge with that is that when we have a systemic issue like this, we need really to see the whole system. We really need to bring together folks that don't normally talk as much to discuss, how the different areas of their expertise interact. And so that's what we're trying to do, and we're trying to connect the people, Extension, and the researchers who can learn from each other and learn about, what are the biggest issues on the ground that we can focus on in research, what are the things that those researchers can share out through Extension. Also, I'm trying to provide support for state decision makers. We're trying to provide support to them to make science-based decisions about how to address food system issues happening in Ohio right now.
Wow, Zoe, this is fantastic. Thanks so much for spending some time with me and with our department today to talk through some of these issues. I mean, this is really interesting, and obviously this is a huge public policy issue right now, and it's not just a public policy issue, but it's an individual issue that affects all of us. And getting a few insights from you today has really helped, I think, enlighten us on this topic, and we really appreciate it. So thanks. We're here with Dr. Zoe Plakias, who's an assistant professor in the Department of Agricultural, Environmental, and Development Economics at Ohio State University, and also the co-chair of the College of Food, Ag, and Environmental Sciences Task Force on COVID-19 and the food system. So Zoe, thanks so much for being with us today.
Thanks, Brent.